All right, y'all, it's been exactly 1 week since I put out my Media Lies Coronavirus Edition, and I'm already back for part 2 because the media cannot stop lying about the president or drumming up fears about the coronavirus to the American public. So without further ado, here are some of the biggest lies and miscalculations the mainstream media has peddled to the American public over just the past week. Let's start off with the reporting that hospitals are running out of much-needed protective gear and ventilators. This photo went viral of 3 nurses wearing garbage bags over their protective gear at Mount Sinai Hospital, located in New York City. This caused widespread outrage after it was found out that these nurses worked at the same hospital where another nurse had died just days before. The cause of his death was not confirmed, but various medical staff tied his death to the shortage of personal protective equipment and basic supplies. So when these photos were shared of nurses in garbage bags, they went viral, with the photos being shared with captions such as "No more gowns in the whole hospital," "No more masks," and "Reusing the disposable ones." However, it turned out that this photo and these captions were misleading, with the public relations director for Mount Sinai sharing that the facts are very different than what the media had recently been reporting, that there was and is enough protective gear available, that the photo circulating shows the nurses in proper protective gear underneath the garbage bags, and that if an individual does not have the proper gear, they do not go on the floor, period. And anything said otherwise is simply inaccurate. Also supposedly in shortage in New York are ventilators. The New York Times and others have been reporting that New York hospitals are facing a shortage of ventilators, leading to patients potentially being turned away from these life-saving devices. Take this headline, for example. The other option is death. New York starts sharing of ventilators. But if you scroll down about 10 paragraphs into the story, you'll read that the hospitals have not actually run out of ventilators. Try this with any news story with a headline talking about ventilator shortages. If you read into the story, not one state in the U.S. has run out of or even had to use their stockpile of emergency ventilators. Even Andrew Cuomo, governor of New York, the very place deemed to be the epicenter of this pandemic, had to admit this.
Were there ventilators found in a storage facility or something that the president is claiming that there were ventilators found and that they need to be distributed? Is there any truth to that?
That is incorrect and grossly uninformed. The point is, we have ventilators in a stockpile and we didn't send them to the hospitals yet. Of course we didn't. That's the whole point. The hospitals don't need them yet. The hospitals aren't at their apex. The hospitals have enough ventilators today.
And Dr. Deborah Birx also shared the message that the media needs to stop scaring the American public and spreading the lies that we are running out of ventilators.
And then finally, the situation about ventilators. We were reassured and meeting with our colleagues in New York that there are still ICU beds remaining, and there's still significant over 1,000 or 2,000 ventilators that have not been utilized yet. Please, for the reassurance of people around the world, to wake up this morning and look at people talking about creating DNR situations, do not resuscitate situations for patients. There is no situation in the United States right now that warrants that kind of discussion. You can be thinking about it in a hospital. Certainly many hospitals talk about this on a daily basis. But to say that to the American people, to make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now. And it's our job collectively to assure the American people that it's our collective job to make sure that doesn't happen.
Now, maybe we don't have a protective gear or ventilator shortage, but the USA has the leading number of coronavirus cases worldwide. And this fact is causing a lot of panic. But is this because of Trump's slow response? Well, no. Trump, at the beginning of the outbreak, closed borders to China against the wishes of many, with many reporters and even Joe Biden deeming this closure as xenophobic. The reason why we are leading the world in coronavirus cases is because we're leading the world in coronavirus testing, surpassing both Italy and South Korea. But this rising cases still has many Americans scared, and NBC reported that a man died after he and his wife took chloroquine in an attempt to prevent the coronavirus, after hearing that President Trump said that it could be used as a treatment. After her husband died, the wife warned others not to listen to anything that Trump says, blaming him for her husband's death. Except it turns out that the man and his wife ended up drinking fish tank cleaner containing chloroquine, not the pharmaceutical version of the drug. And as doctors continue to try to treat patients with COVID-19, it has been found out that hydroxychloroquine and azithromycin have been successfully used to treat and drastically improve the condition of hundreds of patients, with this treatment now approved by the FDA. Now, this fear may not be unfounded. I mean, after all, national news outlets have been showing footage of overrun hospitals here in the U.S., like this report by CBS, showing the inside of an overrun hospital room in New York. But wait a minute, this footage was actually found out to be from a hospital in Italy.
This is the main hospital in Bergamo, in Lombardy province. It's one of the most advanced hospitals in Europe.
Now, there are some hospitals feeling the pressure of excess patients, and President Trump, in an attempt to help these hospitals and medical personnel, shared that he would be sending 2 Navy hospital ships, the Mercy and the Comfort, to help with relief efforts in some of the hardest hit states. MSNBC's Rachel Maddow reported on March 20th that this was nonsense and that the ships would take weeks to get to where they needed to go.
In terms of the happy talk we've had on this front from the federal government, there is no sign that the Navy hospital ships that the president made such a big deal of, the Comfort and the Mercy, there's no sign that they'll be anywhere on site helping out anywhere in the country for weeks yet. The president said when he announced that those ships would be put into action against the COVID-19 epidemic, he said one of those ships would be operational in New York Harbor by next week. That's nonsense. It will not be there next week.
But this claim was quickly debunked after both the Mercy and the Comfort reached New York and LA in just over a week after Maddow's claims, resulting in her ridicule and many calling her a fake news peddler. As the media's attacks continue on the president, their goal of bringing him down through negative coverage seems to have the opposite effect, with his approval ratings continuing to rise. And we all know that the mainstream media isn't going to stop lying about him, but luckily, it seems to be working in his favor. This has been Savannah Hernandez for Action 7 News.
Nobody said this life would be easy, and we are truly alive in extraordinary times. If someday in the future we are ever asked, "What did you do during this time?" how will you answer? Will we be alive to answer? For years, I thought we needed to wake others up in order to stop what's coming, and that may be true. But perhaps the reason we are alive and awake is so that we can prepare for it, so that we have time to survive it, and so that we have the time and energy to help others survive it. Buy storable foods, gravity-fed water filters, pure iodine, and other supplies at InfoWarsStore.com. The time to prepare is now. Be prepared. The future depends on it. InfoWarsStore.com.